you're talking about the menopause care vacuum, you're amplifying Alloy as a platform to get real menopause care. Um, what problem is Alloy solving really to this? If you could speak about
Yeah,
what we do, what we offer, and sort of what the benefit is to women.
absolutely. So listen, Alloy is leveraging digital health and helping to democratize access to true menopause experts who are certified, board certified physicians, mostly OBGYNs, who have advanced training in menopause management and are practicing evidence-based medicine, because we know that there is a lack of clinical education in OB/GYN residency programs and primary care residency programs. The vast majority of doctors in primary care or OB/GYN are just not well equipped to counsel women on the physiology of menopause and perimenopause and offer them evidence-based treatment options. And even if those doctors are well versed, which in some surveys, less than 7% of them report that they are, it's very, very hard to get in with them.
Yeah.
There's long wait times, lack of coverage, and just kind of sometimes geographical barriers. Millions, over 4 million women live in areas of the United States that have a OBGYN care desert or very limited access. So by digitizing this and offering this digital health platform, it makes it, one, really convenient because we're in all 50 states, right? And we are lucky that we have this very deep bench of hormone therapy experts and doctors who truly are menopause experts. And we really pride ourselves that the doctors practicing here are following the evidence-based guidelines and combining that with their many years of clinical experience. And I think this is something that's really unique because, yes, anybody can read, as you
Yes.
society position statement. People can take a course, they can go to the Menopause Society and do their Menopause 101 thing. But unless you've had literally decades of years in the trenches of meeting face to face with women, helping them through their women's health concerns, from breast cancer risk to bleeding issues to fibroids. I mean, I've seen and done it all. I've been in the OR. I've taken care of all these women. So when it comes to menopause, me and my colleagues at Alloy, we know how to manage all of those different women's health concerns when it comes to menopause and hormone therapy. So you can't, you can't really put a price on this really valuable resource that this clinical experience combined with evidence-based medicine that we have here at Alloy. What's great about Alloy is we make it super convenient too, right? And so we all know how busy doctors are and how busy women are with families and careers and other things, right? And so once you come to Alloy, you get assigned to a physician who's licensed in your state. And it's asynchronous. So we review your symptoms and your history, and then we can message you at any time back and forth. So we have this really ongoing line of communication. Because as we learned during this webinar, right, it's not that hormone therapy is really complicated or, really hard to do, but it often takes some trial and error and a lot of visualization. And so by having this open and easy line of communication, we can make changes quickly. We can alleviate concerns or side effects or answer questions really, really quickly and effectively in a manner that I think is really disrupting the space in a really positive way, right? Because the old, model of, waiting months for an appointment, then you've got 10 minutes with the doctor, and then if you've got problems or you want to change things, you've got to make another appointment and come back in 3 to 6 months later. And that is just really, that kind of is a huge barrier for many women in actually getting evidence-based adequate menopause, care. And so I think for all of those reasons, I think Alloy is really, a special platform and has set itself apart because of the ease of communication, the access to real experts, right? We're all board certified physicians here. And so I'm really proud to work here. And that's why I chose to practice on the Alloy platform.
Thinking ahead to sort of all of the silos of wellness health outcomes, all of the work that you do, all of the work that Alloy does as a team. What would you leave women with? The end of this year, looking to next, there are going to be women here who are sort of on the fence for one reason or another about hormonal care or, you know, any number of things. Sort of what would you say goodbye to your patients as they're walking out of your office with piece of advice?
I would say take a deep breath. Don't worry about all the noise out there. You know your body better than any doctor out there. If you are in this menopause transition, you're having symptoms, you have concerns about things like osteoporosis, sexual health, other chronic diseases, arm yourself with education. Come to Alloy, the YouTube channel that we have now, all the webinars you've done with physicians, other doctors on Alloy, as well as other leading experts. I'd say this end of the year, give yourself a little time to pause, right? That's what menopause is good about. Like it's making you kind of pause and think a little bit more deeply about yourself. Educate yourself, because when you're empowered and educated, as Dr. Sharon Malone always says, give women good information, they'll make really good decisions for themselves. And I promise you, this is really not that complicated,
Yeah.
and you really deserve to feel great, and have not just a long lifespan, but a really high quality health span. So you've got this.